Let's look at the hepatic arterial anatomy in this patient who has a contrast-enhanced CT scan. Now, when we're looking for the hepatic artery, one of the good ways to start is you see the aorta here, you find the first branch off of that, and the first major branch off of it is going to be your celiac axis. Your celiac axis trifurcates usually into what you can see here is your splenic artery. That's the larger vessel that's coming here, posterior to the pancreas, heading over to the spleen. The second branch that often arises from the celiac is going to be the smaller one that we can see right here, and this is your left gastric artery. And so your left gastric artery comes up here and then goes into your gastrohepatic ligament. The third artery that you typically see is going to be your hepatic artery, and usually that's going to be your common hepatic artery, and then when the gastroduodenal artery comes off, it becomes the proper hepatic artery. And so if we take a look here, we can see that this vessel here, off of the celiac trunk here, you've got the splenic artery, and then off of that splenic artery we can see another vessel coming here, and this one curves around and comes over here and then does this hairpin turn and becomes your right hepatic artery. However, we don't see any left hepatic artery coming in, and so there is no left hepatic artery that's coming off of this particular aspect. If we come down more inferiorly through this vessel here, this is our gastroduodenal artery. So our gastroduodenal artery here would be our proper hepatic artery, but our proper hepatic artery only has a right hepatic artery supplying the right hepatic lobe. So what's happening on the left? Well, the left hepatic artery can also come off of your left gastric artery. So remember, this is our left gastric artery right here. Let's follow it up. We come up further, and then we can see in the gastrohepatic ligament here, we can see that there's this vessel that crosses into the liver, and so this is our replaced left hepatic artery. If this patient also had a left hepatic artery that was coming off of the common hepatic artery or the proper hepatic artery, then this would be an accessory left hepatic artery, but since we didn't see one, this is a replaced left hepatic artery arising from the left gastric artery. The other interesting anatomical variant in this particular patient is if we go to the SMA here, we can see this branch posteriorly emanating off of the SMA here actually supplies the right hepatic artery as well. And so this patient has an accessory right hepatic artery arising from the SMA and a replaced left hepatic artery arising from the left gastric artery.